Did you know that this month, July, is BIPOC Mental Health Awareness Month? If you're sitting there and you're like, what is BIPOC? BIPOC is an acronym, and it stands for Black, Indigenous, and People of Color. In this video, I'm going to focus on the Black community and the disparities that they face. These are all empirical and factual. You can look them up on the APA website. I'm not here to argue why they exist or even a solution. I am here to simply educate you on what these disparities are. Number one, the rate of mental illness in the African American community is actually very similar to the public. However, they tend to receive poorer quality of care and not culturally competent counselors. So that means when a Black person goes to a counselor, usually they don't know how to deal with their problem. Isn't that a problem? Number two, 1 in 3 African Americans who need care receive it. So that means that 66.67% of African Americans who need care are actually not getting it. Number 3, compared to whites, Blacks receive less medicine and outpatient services. So this means that Black people who need medicine or outpatient services are not getting them. Number 4, compared to whites, African Americans are less likely to be offered empirical therapy. So this means that Blacks are not getting therapy that actually has been shown to work. Number 5, Blacks are commonly diagnosed with schizophrenia and less diagnosed with mood disorders. So this means that they're disproportionately diagnosed with schizophrenia, sometimes misdiagnosed. Number 6, the way that African Americans express emotional distress is actually a lot different than other demographics, and this can contribute to misdiagnosis. So when Black people go to get assessed by a counselor, they're usually misdiagnosed because the way they express certain emotions is not the same that other demographics express them. Number 7, Black people with bipolar disorder, schizophrenia, and other psychosis are more likely to be incarcerated than any other race. So that means that Black people who need mental help is not getting it. They're getting thrown in cages instead. Number 8, Black people are more likely to go to primary care doctors or the emergency room instead of mental health services. So that means when someone is in need of mental health services, they are actually not going there. Number 9, another barrier facing the Black community is family privacy. There is a huge stigma of family privacy within the Black community. This meaning that whatever secrets, whatever things going on in the family, just stay within the family. You should not talk to anyone outside the family about it. And because this is generally true, Black people stay away from mental health services because of that. Lastly, number 10, the lack of knowledge of mental health in the Black community is a huge problem. Let me explain. Many Black people don't know how to identify symptoms or mental illness. So when they see it or they experience it, they don't know that help is actually necessary. Also, they don't know the opportunity within mental health services, whether or not their insurance covers it, or if their job offers it as well, or the opportunities within their community that actually supply mental health services.